The chairman of the independent task team for the production of vaccines in Africa, Professor Godwin Nosahai-Bazwaye, said at the roundtable discussion that vaccines intake in Africa is enormous and the outbreak of COVID-19 is an eye-opener. Professor Bazwaye said Africa spends more than $1.5 billion in procuring vaccines yearly, when in essence, Africa has the material, financial, and human resources to manufacture its own vaccines. He said Igbinedion University Okada and Igbinedion University Teaching Hospital is setting a center of excellence not for Nigeria only, but for Africa to deal with the health challenge headlong through the development of vaccines.
Why would we as Africans continue to rely on the exportation of vaccines when we have what it takes to actually produce, distribute, and market these vaccines? So I think, as I keep saying, wherever you wake up is your morning. We have just woken up, and we must continue to pursue this agenda with CODA and all stakeholders to ensure that we can provide vaccines for Africa.
The discussants, who are experts in different fields, said Africa cannot continue to consume ideas, arguments, and production of other countries. They highlighted what it will require to produce African vaccines, to include partnership with other private institutions, confidence, amongst other strategies.
We need to change the mindset that scientific research is the most important pillar for development. So we need the collaboration of the financial institution, the policies. I always call it the triad of empowerment. It depends on three pillars: the people, the policy, and the product.
In order for us to truly create a self-owned industry of vaccine production on the continent, we must also be willing to put up the resources that will be required to start the process.
How do we unlock private sector money to manufacture vaccines? Governments on the continent must create an enabling environment for the private sector to invest in R&D, for the private sector to manufacture vaccines. The government itself must invest in healthcare. We cannot, it cannot at all depend on donors in the West.
The panelists unanimously agreed that social networking was fundamental ingredient and that government should provide the enabling environment for the realization for the production of African vaccines. Best Mbiere reporting.